Hey friends, it's Alison Moe. Thanks for joining my Metabolic Associated Steatotic Liver Disease GHAPP Community Network. Just a couple of questions that I get from patients when we're talking about advanced fibrosis and advanced fatty liver disease. Obviously, when we're doing all the screening, number one question is this reversible? I'm lucky enough to bring a liver model, which happens to be on my bookshelf here. I bring a liver model into the patient's room and I show them the different levels of normal liver, fatty liver, steatotic, fibrosis, cirrhosis, etc. And very clearly explain to them, with diet and exercise and sometimes with pharmacotherapies, fatty liver we know is reversible just with diet and glycemic control and weight loss. We now know that we have an FDA-approved agent, pharmacotherapy, that is also helping us reverse our patients' fibrosis. So I think being able to quickly answer patients to tell them, yes, with the appropriate treatment options, it is very possible for you to reverse even your F3 fibrosis. And then the second question that I get a lot from patients is, what am I allowed to drink as far as alcohol while you're treating me or while I'm being monitored for fatty liver disease? And for me, that is two very different things. If I have a patient who has fatty liver, but they do not have any evidence of advanced fibrosis, I will tell them that while I do not recommend alcohol because of the calories and glycemic index and central obesity and adiposity, it is not a hard no as far as alcohol. But I follow strict AASLD guidelines. If I have a patient who has F2 disease, or if they have really S3 steatotic liver disease, even with F1, I tell that patient that their alcohol intake needs to be 0. And I include that meaning Christmas, New Year's, on birthday celebrations. I tell them it's really not worth continuing to have further injury to the liver with inflammation in the setting of somebody who has underlying fibrosis or even advanced steatohepatitis. As I come up with more questions, we'll kind of review them again. But otherwise, thanks so much. And I'll see you guys soon. If you have any questions, feel free to reach out.